Care Government Ayurvedic Medical College, Hyderabad, Telangana. It's my pleasure to introduce Dr. Shrikant Babu Pergu sir. Sir has completed BMS from SV University, Tirupati, and completed MD in Kaya Chikitsa from University of Mysore, Karnataka. And he is presently working as Principal in Charge, Professor and HOD in Dr. B.R. Care Government Ayurvedic College, Hyderabad. Presently, sir is a Senate member and Chairman for Kaloji Narayana Rao University of Health Sciences, Warangal, Chief Superintendent of Examinations for both Kaloji Narayana Rao University of Health Sciences and Dr. NTR University of Health Sciences, Technical Member in State Ethical Committee for Ayush, Member Secretary, Chairman, PG Guiding Dr. B.R. Care Government Ayurvedic College, Hyderabad, External Expert Member for Pre-PhD Committee, RJHS Bangalore, and Subject Expert for E-Journal Committee, RJHS Bangalore, Question Paper Setter, UG and PG Ayurveda, and Examiner for 8 universities, Member of Editorial Board, and Peer Reviewer in International Journals, Syllabus Subcommittee Member, Kaya Chikitsa from former CCIM, now NCISM. Sir has a clinical experience over a period of more than 3 decades of practice and treated more than 3 lakh patients. He guided 35 PG scholars on various subjects and was awarded Best Teacher Award by Samskara and Paravastu Foundation 2016 at Hyderabad, International Ayurveda Excellence Award by Arkashan Health Sciences at Bangkok of Thailand 2018, Ayurveda Sevak Award 2019, and Best Employee Award from Commissioner, Department of Ayush, Telangana on Independence Day 2021. Sir has international accreditations invited by 8 countries for technical expertise. Sir has more than 16 research publications and organized more than 30 scientific sessions and involved in 5 researchers and published 5 books like Ayurvedic Simple Remedies for Common Maladies, Care for Manasika Vikaras in Geriatric Age Group, a book on Trichology and Ayurveda. Sir has delivered a number of talks as resource person in several national and international conferences, and he trained many aspirants for PG studies free of cost for many years, and many of them got PG seats and serving healthcare system. We are happy to have you here and hear from you, sir. I once again welcome you on behalf of our institution. Thank you. Over to you, sir.
Sir, kindly unmute, sir.
Unmute, sir.
Sorry, yeah. Good afternoon. Namaste, everybody. Am I audible?
Yes, sir.
Respected the pattern, Dr. Betsurmat, and co-pattern, Dr. Mahesh Ji, Dr. Rajesh Udupadi, the Dean, Dr. Sarbeshwar Kar, Principal Garu, the organizing team, Dr. Veena Ji Rao, Dr. Sita Devi, Dr. Jyoti, and Dr. Manasa, and my colleague speakers, Dr. Subin Ji, Anantaram Ji, Pradeep Ji, Sujan Ji, and Srilata Kamaji, and Jigish Ji, Kesar Prasad, Shama Krishna, and valedictory guest Ashok Kumar Panda, CCRIS Bhubaneswar Ji, and the inaugural guest Ashok Gupta Ji. They are students and PG scholars of JSS Ayurveda College, Mysore. My warm greetings from Dr. BRKR Government Ayurveda College, a 82 years old government institution, catering the requirements of many of this particular state and around surrounding states also. So initially, let me congratulate JSS for taking up a program like case series discussions. This is what I can say is need of the hour, rather to say. So I have a lot of affinity and love towards Mysore because I did my post-graduation from Mysore Government College from 90 to 93. So for Mysore invitation, telling no is very, very difficult for me anytime. But at keeping the time constraint, being a principal in administrative and all other protocols, I'm not going into a PPT presentation, giving all the details actually. Sorry for that. Actually, because of paucity of time, I could not able to come out with a beautiful presentation, but I'll be using the Extempo platform to share few of our clinical expertises, what we are doing and how we are doing. Not only success stories, where we have found the difficulty also, I'll be able to share so that we can get some better suggestions from the team who are attending this particular session. So in this way, our college is a government Ayurvedic college hospital, attached hospital, where we have to treat a lot of poor and low income group of patients. You know, government has constraints about the medicaments and all other areas. So in that scenario, so we always look forward for a simple and effective remedies, and the same remedy should be useful for huge number of patients, because our OPs are crowded. We have n number of outpatients into our hospital walking in, and so we cannot literally spare fullest time to cater everybody. So in the first visit, we go by evaluation. Second visit, like any regular busy hospitals. So for that, we were always thinking to come out with a simple remedy or a complex remedy also in certain conditions, which can be used for various clinical conditions. And it can be trained to the postgraduate scholars and internists and final years, and they can also in turn involve into the treatment protocol at every OPD and IPD levels. So with this scenario, we have developed this protocol. These works into BRKR, GAC, and it's attached to Government Ayurveda Hospital here. So we have 48 postgraduate scholars as EWS quota has come, and 63 per year UG scholars. So this is our human resources and basic concern. So coming to the areas, we usually Ayurvedic people, we get a lot of musculoskeletal disorders and neurological disorders into the OP. And we require, most of the times, if we prescribe 2-3 medications and tell the patient to take this 3 times a day in the morning before food, 3 times a day after food, along with XYZ, if we give the protocols like that, most of the times, though we take a lot of attention in educating the patient about consuming the medicine in OPDs, we could not able to reach and educate every patient. There are certain people who, if you advise before food, they skip. If you advise 3 times a day, they use only once, like that. So keeping all these constraints in the clinical challenges, so we have come out with a simple and adaptable remedy like Lasuna shirapaka. So the name only, we are calling it as Lasuna shirapaka, but it is not a classical Lasuna shirapakas which are described in the core textbooks. So what our agenda and how we have adapted, I'll tell. How it has benefited and how it has not benefited also, I'll tell you. So Lasunas, because we need to educate them, this we don't advocate in the month of March ending, April and May, June first week, because this area is very hot during that particular season. So we don't advise medication to such people. So we quickly assess the Costa and Prakriti in regular OPDs. Then we assess the person's weight and the appetite and all other things in a quick OPD reviews by all our trained clinical staff and postgraduates. Every OP will be supported by a senior postgraduate, assisted by second year postgraduate, and assisted by first year postgraduate, along with internists also. So in that way, we assess the clinical scenarios. I'm not going to detail all the clinical scenarios. I'll just share the treatment protocols, what we have observed, and how was the observation. What was our understanding about that? Only that part I'll be going with this. And within the possible time, how many experiences I can share, I'll go with that. So Lasuna shirapaka, we used to see and standardize that into this way, that 5 to 6 loaves of Lasuna. You know, Lasuna is this much, and if you peel it up, it comes to this. So we see the size of the Lasuna. We'll keep the literally Lasuna loaves we keep in the OPD, and we'll show them the sizes that if it is small, this many, 6, bigger, this many, like that we used to tell them. So 5 to 6 or 7, basing on the requirement and severity of the disease. Just crush them, add 50 ml of water, and boil it for 50 to 75 ml of the water, basing on the seasons. Boil it for 10 minutes or 7 minutes, 7 to 10 minutes on low flame. Then again add 30 to 50 ml of milk into that. Then boil it on low flame for more than 7 to 10 minutes by stirring it properly. Once it is thoroughly boiled, then decant it, squeeze it, and keep it into a glass. Let it become swanga shitala or become warm. Then, basing on the cost of the individual, we adapt the Eranda Thaila available in the market, purified Eranda Thaila, which it is available in the market for a common use, like a castor oil, purified castor oil packs. We only use that. And sometimes hospital also will be able to supply this. So purified castor oil, we go for 5 ml or 7.5 ml or 10 ml. So Lasuna shirapaka, it comes around 60 to 75 ml, basing on the quantity, how they boil it. Though we educate them properly, so there are practical difficulties. They don't boil it for 7 minutes. They boil it only for 5 minutes in certain incidences. After putting the milk, the milk will be coming up, so they don't boil it properly. That means 7 to 10 minutes they don't boil. In such scenarios, it may come up to 70 ml. Otherwise, it comes less than 60 ml. So this single dose will add 5 ml or 7.5 ml and 10 ml. How we decide is basing on the costa. So if it is a Vata costa, Krura costa, we go with 10 ml, and Mrudu costa 5 ml. And in between, Madhyama costa, we go with 7.5 ml addition of Eranda Thaila. And this is a single dose we give in the evening time, around evening time, once. And this can be practiced for 7 days, leave a gap of 3 days. Again, we'll go for a second spell basing on the improvements. We used to give this type of prescriptions for all musculoskeletal and neurological disorders, which are commonly coming and patient could not able to. We'll provide the medication if whatever is available from the hospital, like Yogaraj Gugulu and Karpur Thaila, like that. And in addition to that, we used to give, and few cases, they don't come to the hospital, they use only this and they got benefited. I don't say this is thoroughly cured, like Sandigata Vata. Patient comes with a lot of pain and crepitus and other things. We ask them to apply regular warm Tilathaila to the local joint. Regularly, we educate them, and Lasuna Shirapaka will be given. So with this, lot of Vata conditions, Vata disorders like Sandigata Vata and even migraines. So the patient come to the hospital in first visit and second, third visits. We do it in cyclic form actually. They are benefited by this particular area. But where the patient is having acidity and related complaints, this particular prescription has given us trouble. They don't tell that while you are asking repeatedly in the OPDs. They say you have acidity, you have any sort of urodaha, any type of question. They say, no, I'm okay with that. I'm okay with that. When we advocate the Lasuna Shirapaka, after some time, they come on third day or fourth day, or they call the postgraduates, because what we practice here, once we take up such projects, we take all those phone numbers and other things, and each patient will be allotted to 3-4 patients will be allotted to postgraduate scholars. They will call them in every day evening. They will call them and find out how they are doing, and they'll be available for their queries and any sort of pain hikes or something, so that they can suggest the corresponding remedies. In such scenario, Lasuna Shirapaka with Eranda Thaila Anupana. So this is benefiting a lot of patients. We don't see the Prakriti, we don't see a lot of other conditions into the clinical area, which is a general suggestion, and it was useful. But if we can do much more dissection into that, like Desha, Kala, Vaya, Prakriti, Bala, all these things, then it can be more choosy and more optimal. So this is one area I would like to share. Second thing, the recent days, lot of cases they are presented to the hospital with low backache. We have n number of differential diagnoses. So for research purpose, we do all the tests, we confirm the diagnosis, then we go for the research. In clinical scenario also, as far as possible, we'll try to do the investigations. But most of the times, patients may not come forward to wait till the investigations are completed and to start the treatment. So in such scenarios, these are all the clinical challenges I see. This is encountered by almost every government hospital and sometimes in private hospitals also, even in OPDs. So for such low back aches, we have designed a therapy, because if you want to go and treat it conventionally, like, it is Roga Madhyama Roga Gata Marga, IVDPs, intervertebral disc prolapses, is very commonly seen nowadays. So we require to use Avartita Snehas internally. And when you employ Avartita Snehas, it is always expensive. So we have, considering all the constraints in adapting the treatment protocols for the large number of patients, we have designed a protocol like Matra Basti with Pravala. Sometime I'll tell you why we are choosing Pravala or Sudhavargiya Dravyas, especially calcium products in Vata. We have developed a concept that ionic calcium and its functions in the body are more or less, they are mirror imaging like Vata Karyas. If you see Vata, functions of Vata. So in such scenario, we started using calcium ionic forms into treatment modalities, and we are seeing some clinical improvements actually. So in Matra Basti, so whatever is required, basing on the requirement, like Balashwagandha, maybe Sahacharadi or Mahamasha, basing on Sneha, Taratama requirements, we take that and we do Matra Basti. You know the Matra Basti procedures, I did not explain. So I'm not going into all those micro scenarios, because I'm sharing a lot of clinical experiences as far as possible. So we want to use Rasaushadhis into Matra Basti. And after adding Rasaushadhi, I have a doubt whether we still call it as a Matra Basti, because we need discussions, and a lot of technical issues are there to name it once you add Rasaushadhi. So for this, we took Dr. Gopi Krishna from Bellari's help, because he's a Rasastra person. And we have contacted our departments also, and experts from Rasastra all over the country. We have had a consultation. Then after ensuring the safety of this and seeing the practices of using Rasadravyas in Basti Prakriya, and we have few references also for that. So we have adapted Pravala Pisti, 1 gram is emulsified into Balashwagandha Taila or Mahamasha Taila or Sahacharadi Taila, whatever is the Taila we are planning to apply for Matra Basti. Along with that, we add 1 gram of Pravala, we make a lot of trituration, and without any sedimentations, we give that and we see that it is properly administered. And with this, we don't have much of expectations by adapting this. We did not expect any wonders to happen in the treatment modality, but our simple intention is whether we can reduce the cost of the treatment to the patient, and whether we can able to give the comfort to the patient, any additional comfort, and whether we can able to give the comfort at an early date. So these are 3 objectives of our prescription. So to our surprise, after using this in 1 or 2 spells, the patients are significantly coming out with a better clinical improvements. So we have published data on this. Perhaps once I find time, I'll share all the published data with the organizers, so that they can in turn pass to the required teams, because now I don't have time to bring all those things before you. I'm sorry. But definitely I'll share all these papers. I'll ask my PG team to send them, and we'll see that you will receive them. So this is one particular modality. I mean, Rasaushadhis into Matra Bastis. So we have produced 2 dissertations on this work, and we have published 1 article, and second article is under pipeline. Perhaps in coming course, we'll be able to see it in published journals. So third one, of course, this is also, I call it as an offbeat naming. So usually Vardhamana Prayogas are indicated in Ayurveda for specific purpose, like Vardhamana Pippali Prayoga, Vardhamana Makuchi Prayoga, Vardhamana Videnga Prayoga, like that. And we have named it like Vardhamana Yoga, and don't get confused that we are adapting the exact modality what is being described in the textbooks. No. I doubt whether we can call it as Vardhamana Yoga, because the only Vardhamana Prakriya we have taken, and not the principles and the essentials of the area. Our intention is to benefit the patient without any sort of trouble creating. So in such scenario, we have adapted and we came forward with a protocol like say cancer patients, the malignancies, cancer of different areas. Of course, we don't run research projects in that way. These are all common prescriptions we give. They are not research projects actually. So in treatable conditions where within the availability of the hospital infrastructure and time of the physician, what are all the cases we can treat and we can interfere. In those cases, we used to adapt Vardhamana yogas, not only for malignancies, for certain disorders where the disease progression will be there. And we require to intensify the medical dosage day by day to encounter the disease progress and to give them the better quality of life. So with this type of thinking, we have come out with areas. And for that also, we have not used, say if it is a Pippali Vardhamana Rasayana, original Pippali, whole Pippali, no, we have not used. We have chosen the market available samples and we have adapted the Vardhamana principle to that. Like if we want to treat as a Rasayana to Madhumeha, few examples I'll quote. This is a complex scenario actually, but I'll try to give it in a nutshell and convenient and palatable form. Like Shilajit Vati is available in the market with 250 mg packs. We used to adapt 250 mg packs from specific companies. Mentioning company names may not be very good here. That's the reason I'm not telling. If you don't have constraints, I think I can come out the companies also what we use. So this tablet, initially day 1, we give 1 tablet. Day 2, 2 tablets. Day 3, 3 tablets, single dose. Day 4, 4 tablets. Day 5, 5 tablets. This will be the first hike, and 5 tablets. We continue it for 3 days. Then taper to 5, 4, 3, 2, 1, and we'll end up the first cycle. So the pattern of medication is Vardhamana, but it is not the classical Vardhamanas what they have mentioned in the textbooks. I want to make very clear about this. So if second spell, what we do, 1, 2, 3, 4, 5, we have increased in the first spell. Second spell, we start with 4, 4, 5, 6, 7, 8, 8, 8, 8, or 9, 9, 9, like that. We'll go with 3 days, and then we'll come back with the downward trend in that way. And we don't, this is how we were doing it in cyclic form to draw better clinical observations. And we have used Amrita Bhallatiki Rasayana to counter autoimmune disorders. I don't want to name simple autoimmune disorders. You know the concept of autoimmune disorders from Ayurveda, and we have multiple diseases incorporated into this. We have started treating few selected conditions here. For all autoimmune disorders, we use by default, if they are not Pitta Prakriti and the season is not Karishma, then we used to go for Amrita Bhallatiki Rasayana. This is a Lehya form. So then you may ask me how you have used Vardhamana Yoga. Yeah, we have done some exercise on that. We used to take the half kg Amrita Bhallatiki Rasayana available from the market. Within the supervision of the experts, the postgraduate scholars with proper adapting, proper hygienic precautions, they make handmade pills with this lehya, like same sized pills. Mostly, we don't say that it weighs 60 milligrams. No, there will be variations, little variations, but we make handmade pills like material. Pills like rolls with Amrita Bhallatiki Rasayana. The same pattern: 1, 2, 3, 4, 5. 1 pill, 2 pills, 3 pills, like that. We used to give 1 bolus like that. So in hiked manner. And this we have even observed, we have used even for bronchial asthmas, where kapha dominance is there. And many conditions where kapha dominance is there. Bhallataka, it is very good in encountering that area. So to be more cautious and more safer, we use only selected brands. We don't entertain all the brands into Vardhamana Yogas because we are going for a higher dosage at a single scenario. may not be right to choose all new brands. So we go by certain standard brands which we trust, and we go by that only. And this is one area. And like that, Chausashta Prahara Pippali tablets are available in the market. We take them. And day 1 tablet, day 2 2 tablets, day 3 3, day 4 4, day 5 5, and 5 5 5 tablets 3 times a day. 5 tablets once a day for 3 times. Then tap it like 4 3 2 1 and 0. This is first cycle. How we are going to treat such scenarios. So in this way, we have used Bakuchi, we have used Shilajit, Vardhamana, Shausashta Prahara Pippali, Amrita Ballatithi, then Bakuchi, Saptamrituloha, especially in autoimmune alopecias, we go with Saptamrituloha Vardhamana Yoga and Vidangadi or Vidangadi Vardhamana Yoga. And certain times we go with Amrita also, Amrita Ganavatis, like that. So this is one pattern. I don't say that this is all applicable for everybody, and whoever require, we are training and we are doing a lot of clinical activities in the area. So coming to the, Dr. B.R.K. at GSC, while supporting the COVID care from Ayurveda, we have developed some Raksha kits, which contain some Shamanivati, Ayur 64, and Rakshogna Dhupa, then Jivan Dhara like combinations. We have distributed to more than 50,000 people who are serving in the near vicinity of COVID centers. And this was found useful. I don't say that it is, we have not published the data. We are trying, but we are not finding time. We'll definitely come out with a publication on this. So COVID preventive protocols we have developed for doctors, separate protocol, medical professionals, and people who are working around the vicinity of the COVID care. So we have started 2 types of kits and we have distributed, and we found that it is useful, and we are getting a lot of requirement from the users, like police people we have given who are working in the police posts nearby the hospitals where they're declared as COVID care centers, either isolation or quarantine or tertiary care centers. So this is also found useful up to certain extent. And coming to the, about the mucormycosis, which was a health hazard, which has precipitated before us as a complication of COVID management deviations and complications, either way. So government of Telangana and Dr. B.R.K. at GSC are the first of its kind to design and employ an integrative project into black fungus mucormycosis treatments. So this is an integrative project. We are very much thankful to the government of Telangana and Department of Ayush for all their technical, physical, financial supports. And these particular data are also ready for publication. There are 2 major centers in Hyderabad. One notified as Gandhi Hospital is denoted for severe to very severe cases. And government ENT hospital, that is also another nodal center for black fungus. Of course, there are later lot of other centers also they have taken up. When we are integrating government ENT Ayurveda ENT hospital, we have denoted for mild to moderate cases, and we have deputed a team of doctors led by Dr. Praveen and Dr. Ramadevi. And Gandhi Hospital, we have adopted severe to very severe cases where there are surgeries, post-surgical cases. And this particular team was personally monitored by me and Dr. A.U. Shankar Prasad and other team. Our postgraduate scholars and houses, they have interfered into this project very intensely, and we are all thankful for their fullest commitment to treat mucormycosis by integrative management, by adding Ayurveda therapies, add-on therapies, to contribute health to the sufferers and to save the finances of the state. So we have wonderful data. We are ready. We have already submitted this data. I cannot share this data. It is in pipeline for publication into reputed journal very soon. I don't say very soon. It is under reviews. So we have done 3 reviews. Set they're asking for reviews. Yes, we will definitely. We are confident that we'll come out with a wonderful publication into a wonderful journal. So once it comes out, I think I'll be able to give you more technical details on this. So coming to the another area, like muscular dystrophies. Muscular dystrophies, Duchenne's muscular dystrophy, because you know all the theoretical part. And this is a challenge. We need to accept this is a challenge. So whenever we employ a lot of treatments, a tentative improvement will come. And soon after that, the improvement comes down and disease takes over. Rogi bala comes down, roga bala takes over. So this is a ever-time challenge for any practitioner. So after seeing a lot of suffering from this group of patients, we don't have a postgraduate center in Kaumar Bhritya. So taking that, Lasuna Kai Chikitsa want to extend support for this group of patients. We have tried a lot of remedies. We have tried many therapeutic procedures, but no, we have failed to give a dependable treatment, where we can claim that we are very happy about this particular treatment protocol. But after modifications, initially we have financial constraints. We want to go for economy products where we could not able to get the result. Then we have removed that barrier. Then we started thinking about what is needed to be done in this particular group. Then we have come out with certain combinations where we used to see the CPK levels. CPK level is not a diagnostic test or prognostic test for muscular dystrophy. We know that. But people, they come to us after genetic confirmations of muscular dystrophies. Their CPK levels were 42,000, 28,000, like that. And when we initiated this particular new formulations, we used to see within 6 months, these 42,000 CPK levels are coming to the absolute normal 200, below 200s. So this is not happened to all cases. We have deviations. Very few cases, they have not come up to this level. They have come up to 600. They have stopped. From 24,000 CPK levels, from 24,000 to 600, they have come and they have become stagnated. And bringing from 600 to 200 is a clinical challenge for us. Even now, we could not able to do that. But in certain cases, it has come, and patient's comfort levels, that disease progression level has come down and patient comfort level has increased. And this particular improvement is observed below 6 years. We are finding better improvement, and 6 to 14 years age groups, we could not able to give that much of, say, comfort to the patient and improvement, clinical improvements. And in adult group, we have got around 23, 24, 25 years cases. Very few we could able to treat, very few, but we could not able to see much contribution from the treatment. We don't see, we can say that there is no much clinical significance of the treatments we employed into those cases. But the basic components, what we have used are Pippali Churna, Dhatu Paustika, or Ashwagandha, or Shatavari, either one of this, and Rasrajaras as main ingredient. I have discussed this with people who are working in other parts of the country. We have discussed, interacted with muscular dystrophies and how they are treating. We don't want to go for Panchakarma therapies here because the babies are very tender, and we want to go for a longer duration. So Rasrajaras and Haritaki Churna. We have made a specific combination. I told you I cannot give you the rationale behind this. We have worked out a lot of rationale on this, but if I go on explaining all the rationales, I may not be able to share the formulations here. For that reason, I'm not sharing all those stuff here. So this is one area. Still, we are struggling to come out with a colorful protocol. But though it is very, very difficult, yet we are trying our level best, and we have not quitted. We are working on this. So next area is Hyderabad is a place for number of sports academies. We have lots of sports academies working out in Hyderabad, archery academy, cricket academy, badminton academies, athletics, like that. In such scenario, we used to get a lot of sports injuries to the hospital. So among that, I don't discuss about much of the varieties of the sports injuries because it is a different domain. So we know surgical correction will be most of the times ACL tears and other things, if it goes to that particular level, people look for surgical interventions. But whereas we want to give non-surgical treatments, because I'm basically from Kaya Chikitsa. So I'm HOD, professor and HOD of Kaya Chikitsa also. So we want to see the possibility of giving the best from the Kaya Chikitsa department. So we know, because we don't want to employ snehas there. We have our own constraints in that we have developed a concept on sports injury. We know that it is Vata, but we want to treat it in a different domain. So we started using Lakshadi Gugulu and Marma Gulika for external usage. Marma Gulika, while we are adapting for external LEPAs, I took the help of one of my senior friend, close friend, Dr. Subhos, who is working as a research officer for CCRS in Kerala now. Trivandrum, he's working right now. We are very good friends from the beginning. So we had interactions, exchanged the clinical exposures. In that area, I thought Marmagulika may be more helpful. And we have treated, I don't say hundreds and hundreds, but we say tens of cases we have treated. And I don't say all the cases have improved, but significant improvement we could be able to give to each case. But few cases, they have become normal. And one case which was referred to us from Madhya Pradesh, he's an orthopedic surgeon. He referred a case to us. No, he did not refer the case actually. The patient was taking treatment from him. He came to us and we have treated, and then he reported back to that consultant. And he himself, the doctor himself, had an injury, ACL tear. So he came here. We have assisted him with the protocols. He was appreciating our work also. And he also improved significantly. We have not published data on this. Sports injuries is also an area where we are working out. So this is a potential branch. Friends and colleagues, I request all of you to encourage the younger generation, like postgraduates who are coming out. They can start sports clinics, exclusive sports clinics with a separate protocols. Not every case requires Snehana. Remember this. So when there are certain indications where you cannot go for Snehana, yet you can treat Marmaghatas. So in that scenario, if you can work out, perhaps sports injuries is going to be a wonderful research and prospective area for the youngsters to settle in. So these are a few areas. And coming to the other area, like trichology, a science related to human scalp and hair. A science related to human hair and scalp is called trichology. And perhaps we are the pioneers, we say. I feel proud. I don't feel that we are climbing this. Yeah, we feel proud that we are the frontliners for trichology in Ayurveda. So we have organized a national seminar sharing and training hundreds of people to share our expertise. I have traveled extensively to train the local practitioners on this, and by one training we can improve their clinical skills and they can improve the clinical success rates by adapting training sessions. So here also we use common drugs like Saptamrutaloha, Pravala and Kasisa, Bakuchi, Videnga, etc. So I'll just tell how we just modify simple things and we can see the betterment. Say Palitya, the premature graying of hair, you can see. We don't say that we are treating Palitya because we are not trying to do Samprapti Vigatana. So the Palitya is a very, very difficult area to treat with. Kalitya you can treat, Dharunaka you can treat, Arumchika you can treat. But coming to the Palitya, it is a clinical challenge actually. If anybody says that we have treated huge number of cases, yes, we have treated huge number, but how much we have given the benefit, if you see that statistically Palitya cases among trichology cases will be lesser than any other group of cases. So what we have adapted here is like any hair oil, what we are adapting for the patient, like Nilibrunga Amalaki Taila or Nilibrunga Raj Taila, Amalaki preparations or Vibhitaki Tailas. So we add 100 ml of Taila, normal Taila, we add it with 10 ml of Bakuchi Taila. We rinse it and we ask the patient to apply it to the only hair, then preferably in the night times or ask them to apply in the morning 6 and take bath before 8 o'clock. Because bakuchi, if you are adding, and it may cause irritation if they get exposed to the sun. And it may even leave sunburns in certain cases. Very rare, very, very rare. If you add more of bakuchi, but 10 ml in 100 ml is very, very diluted, and it improves the pigmentation of the hair. And I'm telling you, this is like dyeing only, and this is not samprapti vigatana. For Khalitya, we do samprapti vigatana. For Dharunaka, we have come out with Gunja Moola Taila. Dr. Krishna Nayak has done work on this. And Khalityas, Dr. Sapidi Sirisha, she has published the data. We have used all the modern equipment also to measure how much patient is improving. And we have published that particular clinical case series we have published. And Gunja Moola Thaila application against Dharunaka, we have published this particular data also. So these are the areas where we are working out. And we have produced one dissertation work on hirsutism also, hair loss, not only hair growth, hair loss also. Dr. NNL Bhagavati, she worked on this particular area. And not only this, we have a lot of innovations brought to the clinical level. One of our postgraduate scholar by name Bharatiya Pataka Raju, we have come out with a nebulization, Ayurvedic nebulization using 3 drugs. Sirisha, ST, and Bharangi. We have made extracts of arkas and we started using nebulizations, not in acute cases. We don't claim that we are treating all the acute areas, but nebulization, herbal nebulization, rather to say, herbal nebulization in proved bronchial asthma cases. We have data and we are writing the article. It is under pipeline, perhaps very short time because it's almost in the reviews. So we will, once I approve it, goes for the press. So we have submitted that dissertation. We took all the permissions from the universities to go further. So we will be making available of this data also, like herbal nebulizations and their limitations. We have used only 3 drugs, so we have limitations for that. If we can go with 5 drugs, definitely we can give better improvement. We have used all the nebulization instruments which are available in the market, but the drug is Ayurvedic preparation. So we have a wonderful work. I appreciate Raju for taking up such a very intense task. He has worked very hard on that. Coming to other areas like muscle spasm. You know, muscle spasms will be there, emaciations will be there, where if we want to go for Sneha Svedas, we go for a single Taila or Gruta Abhyanga or Yamakas or Trivrut or Mahasnehas. We want to take up a separate combination like simple Sneha, like let it be Balashwagandha or Mahamasha or Sahachara or whatever it is, the Thaila, along with the white yolk of the egg. We make emulsification and we do Abhyanga on the emaciated group of muscles, and we are now recommending this process to many of our professional colleagues who are doing work with us hand in hand. So, like any Thaila, added with egg white yolk only. If you add yellow, it leaves foul smell in the theatre, especially Panchakarma areas. If you want to maintain the cleanliness and hygiene, it will be very, very difficult if you use yellow yolk. So be very careful in isolating yellow and white yolk. Only use white yolk along with this and do Abhyangas with your own hand, and you can experience the comfort when you are doing, and you can see the clinical improvements more than what we use oils or gritas, Thailas or gritas. So this is one area I would like to suggest. Of course, every treatment modality is not a uniform for everybody. These are the few areas where we are working. We are sharing our work patterns, and definitely few may accept, few may suggest us. Yes, we are open for everything. And coming to another areas, when we are treating malignancies with Vardhamana Yogas, the patients ask us whether we can go for normal water or any medicated water. This has given us a thought of going with a Aushadhi Kruta Jala. So for this, we started using Amruta, Punarnava, like 50 grams of powder into 500 ml of water. We soak that into cold water, normal water. We rinse it. Then we ask the patient to consume it till it is consumed in the morning. So this also, we have had a concept on this because, neoangiogenesis will be a process in malignancies where it takes time, it consumes a lot of energy in this particular process. They require to interfere. If we can interfere into this type of neo process, definitely we can help the patient. In such scenario, we have started using Aushadhi Kruta Jalas in various ends. And perhaps we are doing that now. Amruta, Abhaya, Punanava, Amalaki, Trifala. So we make combinations basing on the requirement, not only for malignancies. Later we have adapted this to common clinical scenarios also. So here, 5, 6. Few of, so I'll just also share one instrumentation we have come out. It's not from the college. So my son who completed his MBBS, we were interacting with a lot of younger generations. So the gyroscope, which is available in the iPhone for various purposes, they have isolated and they have made it, they have tied it to the spoon, grooved spoon. With the task is when a Parkinson's patient want to eat anything, the hand movement will be like this. And by the time he picks the food into the spoon, it will be full. By the time his spoon comes to the mouth, the lid, it will be empty. So this will be a very challenging task actually. So by adding a gyroscope to the spoon and making some modifications and software adaptations into this, they could able to develop an instrument where they can consume food without much of spillings. So this is not from the college. This is also an innovation we are working out. We are joining hands with a lot of NGOs because our intention is to reach poor and reach remote areas. So this is our task. And now I hope we can have some discussion in coming 10 minutes. JSS team, you may take over now. Thank you for patiently being with me. And we can initiate interaction now.
So thank you very much, sir. So thank you very much for for sharing the successful formulations in the clinical practice in different diseases. So we have some questions like one you have told the Shilajitu or it is a Shilajitvadi Vati, sir? In the
we have used Shilajit Vati only.
Single drug or it's a combination?
Huh?
Single drug Shilajit?
No, it is not. We are using Shilajit Vati from a specific company. Shodhita Shilajit, they give it for 250 mg pills. It is an ancient company. They are still marketing by handmade pills only. Okay. We have used it.
So whether it will going to have a hypoglycemic activity or whether it will prevent the diabetic complications, like in what?
This is really a good question. Actually, this is not for seeing any hypoglycemic areas. We are using it for a long-time sustenance because however you control the blood sugar levels, they go for macroangiotic and microangiotic complications, and ultimately they will land up. To minimize that, we are going for the Vardhamana Yogas as a Rasayana Prayoga, so that we need to see how it is helping, because it is an initial stage. We cannot have any claims that it is preventing kidney disease or it is preventing microangiotic complications like that. It is too premature to comment anything. We are working on that. And yes, it is helpful. Vardhamana Yogas, not only this, in certain areas we go for even Nishamaliki Vardhamana Yoga, where the few patients, they are posted for the surgical corrections. Though they are shifted to insulins to the optimal level, their sugar levels are not coming to the say not properly monitored, glycemic levels. So in such scenario also, we use Nishamalaki as our Dhamana Yoga, and we can help them to undergo for the surgical areas. We have 6-7 cases we have assisted like this. We don't have much data on that.
Thank you, sir. And one more question is, which is the standard brand for the Amrita Ballataka you use so that we don't get any complications?
Yeah, actually, we have trust in 2 pharmacies like IMCOPS, Indian Medical Practitioner Cooperative Society at Chennai. They do purification of Ballataka by Ishchika Churna. We have visited several times. So we accept that. That is one particular brand we use.
Pravada Pishti, you have told in the Matra Basti. So how
Yes.
long it can be given, sir? How long?
7 days. Each cycle will last only for 7 days. And we see next month we'll go for the second cycle, basing on the requirement. Only for 7 days.
See, this Bakuchi with any herbal hair oil you have told. So how long it
Yeah.
can be used? Like whether any limitations? So
See,
night application
actually,
and morning taking baths.
yeah,
Applications in the night and morning taking
night
bath.
or early morning also. People who
Early
woke up early, they can apply that.
1 or 2 hours.
No, that can be left, but basing on the time they wake up. If they are waking up by 8 o'clock, we don't advise, because sun rays, if they are Pitta Prakriti, because we don't go with everything there, because, once you tell to the patient, they will advocate the same prescription to many people. So that may leave, say, unwanted clinical situations there.
Thank you, sir. Thank you very much for sharing your clinical experience and specific successful, you can call it as Siddha Ushdas in the some of the clinical conditions.
This is the credit of BRKR Government Ayurveda College and Department of Kaya Chikitsa as a team. We have a lot of wonderful team we have. So all to putting together, we are working out on these areas. I thank all my team for being with me in every step what we are working. Thank you for.
Actually, we have heard a lot about you, and now today we are fortunate enough to have a lecture from you. Thank you very much, sir. Please do connect it for our valedictory function event. Thank you, sir.
Thank you.
Kumar Panda sir, namaste. Sir, your voice is not audible, sir. Sir, shall we start the program, sir?
Yes, yes.
Yes, sir. Thank you, sir.
Can be sandwich. Hey.
With pranams to His Holiness Mahaswamiji, namaste all. What are the various modes, methods of gaining knowledge? Ayurveda and Darshanas have mentioned numerous ways for this under the heading of Pramana, and Yukti is one among them. Department of Panchakarma of JSSAMC, the Medical College, have utilized their Yukti to confer Yukti to all our students of 4th BMS, interns and PG scholars through the online platform by organizing this online case discussion series, which is aptly named as Yukti, in which over a span of almost 2.5 months, from 15th December, every Wednesday till today, 10 speakers from pan-India have shared the rich experience in treating many cases, rather complicated cases, which may be utilized as ready reckoner by all our budding doctors. Let's start this valedictory program of Yukti by invoking Lord's blessings, for which I call upon our intern, Dr. Samprita. Dr. Samprita, please.
Jaya Ganesha, Jaya Ganesha, Jaya Ganesha, Pai. Jaya Ganesha, Jaya Ganesha, Jaya Ganesha, Pahi Ma. Jaya Ganesha, Jaya Ganesha, Jaya Ganesha, Rakshamam. Jaya Ganesha, Jaya Ganesha, Jaya Ganesha, Pahi Ma. Jaya Ganesha, Jaya Ganesha, Jaya Ganesha, Rakshamam. मुदाकरात्तमोदकं सदा विमुक्तिसाधकं कलाधरावतं सकं विलासिलोकरक्षकम् अनायकैकनायकं विनाशिते बदैत्यकं नताशुभाशुनाशकं नमामि तं विनायकं जय गणेश जय गणेश जय गणेश पाहि मां जय गणेश जय गणेश जय गणेश रक्ष मां जय गणेश रक्ष मां जय गणेश रक्ष मां.
Thank you, Samprita. It's time to welcome all the dignitaries and attendees to this program, for which I welcome Dr. Sita Devi, Madam. Madam, please.
Good afternoon, one and all. Pranamas to the lotus feet of His Holiness Sri Shivratri Jagadguru Deshikendra Mahaswamiji. It gives me an immense pleasure to welcome you all to the occasion of valedictory function of Yukti 21-22 online case discussion series conducted by the Department of Panchakarma, JSS Ayurveda Medical College, Mysore. First of all, I welcome today's chief guest, Dr. Ashok Kumar Panda, Research Officer, Central Ayurveda Research Institute, Bhubaneswar, Odisha, to this function. Hearty welcome you, sir. I welcome Shri Mahesh R, Director, Medical Education, JSS Mahavidyapita, to this function. I welcome President of today's function, our Principal, sir, Dr. Sarveshwarkar, to this function, who is giving constant encouragement and support throughout the case discussion series. Welcome, sir. I welcome Dean Academics, Dr. Rajesh A. Udapudi, to this function. I also welcome the speakers of Yukti 21-22 event to this function. I welcome Dr. Veena G. Rao, HOD, Department of Panchakarma, to this function. I also welcome all the teaching staff, PG students, internees, and UG students to this function. Thank you.
Thank you, Madam. On behalf of all, I also welcome you to this program. 10 sessions over almost 2.5 months is a huge period of time and was a real knowledge storm. I now request HOD of Department of PG Studies in Panchakarma and the brain behind this Yukti case discussion series, Dr. Veena ma'am, to kindly present the successful report of Yukti. Madam, please.
Good afternoon, everybody. My humble pranamas to the lotus feet of Jagadguru Shri Shri Shivaratri Deshikendra Mahaswamiji, respected Chief Guest Dr. Ashok Kumar Panda, Director Shri R. Mahesh, Principal Dr. Sarveshwarkar, and the speakers of different sessions, colleagues, delegates, and their students. The Department of PG Studies in Panchakarma, JSS Ayurveda Medical College, Mysore, Karnataka, has organized an online clinical discussion series Yukti 21-22 from 15th December 21 to 23rd February 22 on every Wednesday between 3 to 4 p.m. Totally 10 sessions by the legends of Ayurveda from Pan-India. It is conducted under the able guidance of Director Shri R. Mahesh, Principal Dr. Sarveshwarkar, and the Dean Academics Dr. Rajesh Udupudi sir. Though it is online, it is in hybrid mode, wherein our final year UG students, the internees and the PG scholars are watching the live session on the screen. About inaugural session, Dr. Arun Gupta, Professor and Head, Department of Panchakarma, Chaudhary Brahma Prakash Charak Samsthan, New Delhi, has inaugurated the event Yukti 21-22 on 15th December 21 at 2:15 p.m. with the gracious presence of the Executive Secretary JSS Mahavidyapita Dr. C.G. Betsurmat and our Principal. After the inaugural session on the same day, the first case discussion session was by Dr. Subin Vaidyamadam, Assistant Professor, Department of Panchakarma, VPSV Ayurveda College, Kottakkal, Kerala. So he has discussed the successful treated case of low backache, osteoarthritis of the knee joint, and even the hemifacial spasm, with the due importance to the Kalabasti and Nasya. On 22nd December 21, Wednesday, Dr. Pratibha C.K., Professor and Head, Department of Panchakarma, GS Ayurveda College, Uttar Pradesh, she has discussed a successful treated case of Parkinson's disease or the Kampavata. Dr. Pradeep L. Grampurohit, Professor and Head, Department of PK, KLE BMK Ayurveda Mahavidyalaya, Belagavi, he has narrated the treatment of a case of cirrhosis of liver, a Jalodhara, on 29th December 21. On 5th January 22, Dr. Sujan T.K., Professor and Head, Department of Panchakarma, Government Ayurveda College, Thiruvananthapuram, Kerala. So he has described the treatment of some 5 conditions, the Gridharasi, Kampavata, Staulya, etc. Dr. Srilata Kamath T., Professor and Head, Department of PG Studies and PhD Studies in Kaya Chikitsa and Manasaroga, STM College, Udupi. So she has dealt about the successful treatment of perniosis, a Vatarakta, a dermatological case. On 19th January 22, Dr. Jigish P., Professor, Department of Panchakarma, VPSV Ayurveda College, Kottakkal, has explained the treatment of supranuclear palsy and the facial palsy. Dr. K.S.R. Prasad, Professor and Head, Department of Panchakarma, LN Ayurveda College, Bhopal, Madhya Pradesh, has discussed successfully treated case on Gridharasi and Pakshaghata in 2-22. Dr. G. Shamakrishnan, the Chief Medical Officer, Department of Indian System of Medicine, Kollam, Kerala, on 9th February 22, described the treatment of acute radiculopathy in lumbar IVDP and even juvenile arthritis or the Vatarakta. On 16th February 22, Dr. Chandaliya Sachin, Professor and Head, Department of Panchakarma, Shri Ayurveda Mahavidyalaya, Nagapur, Maharashtra, has discussed on the treatment of the Guillain-Barré syndrome. So today, Dr. Shrikant Perugu, the Principal, Professor and Head, Dr. BRKR Government Ayurvedic College, Hyderabad, Telangana. So he has discussed on the successful unique formulation in different diseased conditions. It is said that Satata Adhyanam Vadaha, Paratantravalokanam, Sadvidhyacharya Sevacha, Buddhimeda Karoganaha. Each and every the knowledge and the clinical experience sharing session was excellent and highly informative in terms of clinical applications of Panchakarma therapies and even Shamanaushadis with a strong logic behind it. So each session was followed by question and answer with in-depth interaction. So in total, it is a great feast of knowledge for the UG students, internees and PG scholars, and even for the staffs. Now we are at the fag end of the event Yukti 21-22, the valedictory function, where the platform is shared by Dr. A.K. Panda, Research Officer, Central Ayurveda Research Institute, Bhubaneswar, Odisha, and our Director, Principal, and Dean Academics. So thank you. Thank you all.
Thank you, madam. We have with us Dr. Ashok Kumar Panda, sir, as our guest today. I now request Dr. Jyoti, madam, to kindly introduce our guest to all. Madam, please.
Om Dhanvantaraya Namaha. I bow my head to the lotus feet of Sri Shivratreshwara Deshakendra Mahaswamiji. Good afternoon, everyone. Myself, Dr. Jyoti, reader in the Department of Panchakarma PG Studies, JSSAMC Mysore. It gives an immense pleasure to introduce today's chief guest, Dr. Ashok Kumar Panda, sir. Sir, born on 8 July 1969, sir pursued his post-graduation from MD in Kaya Chikitsa IPGAE and R at SVSP Hospital, Kolkata in the year 1998. Sir started his career as a lecturer in BGM Ayurveda Medical College, Gadag, Karnataka in the year 1998. Later, he worked as an assistant professor in SJS Ayurveda Medical College, Chennai. In the year 2006, Sir has joined as a research officer at Central Ayurveda Research Institute, Bhubaneswar. From 23rd Jan 2016 to till date, Sir is working as a scientist and research officer at Central Ayurveda Research Institute, Bhubaneswar, Orissa. In his career, Sir has achieved many heights in the field of Ayurveda research. Sir has worked as a PI in many research projects under ICMR, to name few. Clinical evaluation of Bilva Majja Churna in Grahani, multicentric clinical trials of the Datri Loha in Kafaja Pandu. Sir has also holds many membership of professional bodies. All India Ayurveda Specialization Association, life member of Research Society for the Study of Diabetic in India, life member of All India Association for the Advancing Research in Obesity. Sir has published more than 100 articles in national and international journals. Sir is also an editor of 3 renowned journals and he is a reviewer of more than 10 journals. Sir has written 2 books chapters. Sir has vast clinical and experience in research. He has an important objectives of the life to mainstreaming Ayurveda through the generation of good quality doctors and production of data to create evidences in gray area of modern medicine through the research and publications. Sir has a special interest in research areas such as chronic liver and kidney disorders, chronic pain management, autoimmune disorders. I am very thankful for giving me the opportunity to introduce such an eminent personality, today's chief guest, Dr. Ashok Kumar Panda, sir. Once again, I welcome you, sir, and I request you to take over the session, sir.
Thank you, madam. Very good. Many thanks. So, thanks to the organizer to giving me a chance as a chief guest, and my friend Dr. Sarveswar Kara, who we are also visited. I also visited many times to your hospital and JSS Ayurvedic Medical College. What happens? Am I audible? Hello.
Yes, sir, you are audible, sir.
Yes. So actually, you are done a very nice program, a very long programs where you are setting a lot of renowned doctors. Some of my are friends, colleagues. Dr. KSR Prasad is my colleague before. So it is a very wonderful, things that you have done as a Yukti. Actually, Yukti is a pramana in Ayurveda, where we are associating all the symptoms in terms of guna, karma, guna and karma. Like Vata, Pitta, Kapha, you know, Vata has Dravyatta Vriddhi, Gunatta Vriddhi and Karmatta Vriddhi. See, the Dravya, Guna and Karma are three cardinal things in terms of that we are formulating the designing the treatment protocols like that. So when we are planning any medicine or we are designing any type of treatment protocols, then we are using the Yukti Pramana. So it's nice program, and I appreciate your and very good that young doctors. You know, basically what madam you introduced me, I am more focusing on CLD, chronic liver disease, and chronic kidney disease is my focusing area. Uh, and you know how we are, you know, people that maximum patients are now fatty livers. Hello. What happens? Am I audible? Hello.
Yes, sir.
So,
You are audible, sir.
So these are the all my one. I want to give some of the things. What is fatty livers and how it will be manifested through. Is more of the young, even the very small students are also susceptible for the fatty liver due to high intake of junk foods. Most are triglycerides, more blood triglycerides, and more is sedentary lifestyle is leading to fatty liver disease to most of the younger mass, and which leads to cirrhosis of the liver and also liver cancer. You know, people said that the कोई पेशेंट आएगा, मैं हिंदी में थोड़ा बोल देता हूँ, कोई पेशेंट आएगा पूछेगा सर मैं तो दारू नहीं पीता, हमको क्यों डिजीज हो गया? तो यू नो फैटी लिवर इज क्लासिफाइड एज टू टाइप्स, इज non alcoholic fatty liver disease and alcoholic fatty liver disease. So alcoholic liver disease we are telling as a ALD, then non alcoholic fatty liver disease. So that's many focusing area is our non alcoholic fatty liver disease, which is next please, which is please next slide. So which is also known as non-alcoholic fatty liver disease, and it will be very relate with your diabetes. Okay, so many pre-diabetic condition. If you see a patient having fatty liver, you should warn him or her. You may go for diabetes. So you see all the metabolic things like your lipid profiles and also blood sugar. So you also done how we diagnosis. Next. You go first. Next, please. So these are the Jakrut, how it is, these Ayurvedic things, you know. These are all the functions. Next, please. Next, please. Next. These are next. Click. These are the stages, how the healthy liver is changes to liver cancer. You know how the gradual fibrosis takes place. That is next, please. Next, please. Next slide. Next पे जाओ. This is also the non-alcoholic fatty liver disease. How it is producing, how the triglyceride. This is, you know, I created these things. Medoja Jakritraga. How it is producing in a, you see, it is a very good pathophysiology I myself made, and it is also published in some of the journals. And how the Mandagni, how all the dhatus are, you can see it's a very wonderful pictures. You can see how the Medodhatu, Medagni, there are two types of Medo, Durmedo and Oveddo Medo, how the Dhatu Agni Vaishamya, how kapha pitta enter to the, and how it is producing sotha and lipolysis and Jakrut Roga like that. It's a very wonderful, we just done it, the pathophysiology in terms of your diagrammatic representation, how the liver disease, Gorobiso, Dusibiso, everything, credo, how credo is related, how Soto created. So it's nice diagrammatic presentations. I myself have the idea and I done it. Next, please. So say why I choose this disease, because maximum you get 60% of your fatty people, so obesity people having this problem. So if our students can learn this, then they will be able to treat them. Next, please. Next. These are the symptoms. There is no symptom at all. So how the prevalence study? Prevalence is 9 to 32%. It's a very high prevalence disease, and you are getting also in your OPD. Next, please. Next. Next, jao. High prevalence disease. Next. Please, is next slide dikhao. Diagnosis is a very important part. How you diagnose? First is ultrasound, then fibroscan, liver, LFT. You will see the SGOT, SGPT levels. Then CBC, you can see the platelet level, how the total platelet count. Then liver biopsy, electrolytes, lipid profile, and sugar. I told you before, urea creatinine. Then symptoms, some maximum patient are asymptomatic, and very important is history of liver disease. कोई पेशेंट आता है, बोलता है सर मेरा पिताजी को लिवर कैंसर में डेथ हुआ, मेरा भाया का ऐसा हुआ, सर साहब देख लीजिएगा. So that is very important, the history of liver disease. Next, please. Next. So these are what are the primary prevention? How will do? So you should not take junk foods. You should take good vegetables, more vegetables, and you don't take more fatty foods like boda. Your boda, you should take Italy only. Okay. So these are the, I take what is the good garlic, green leaves, broccoli. These are the good beets, fruits that you have to take for good to how to look your healthy liver. Next, please. Foods gone. Next. These are the effective yoga. What yoga asana? Yogic posture also reduce. We have published on paper. Effective of yogi intervention in non-alcoholic fatty liver disease. The case series. I am the authors of that. And issue. These are the yogas which are very improving, and it also reducing the liver fibrosis. Next. Next, please. Next को बताइए. हाँ. Yes, this is very good study. I also done it, is published on my behalf. And आरोग्यवर्धिनी बटी फलो पटल कटुर एनादि कषाय फलत्रिकादि कषाय साइटोजेन लीव 52 लोकनाथ रस and apple and onion, because it is quercetin is more in apple. You should take tell them to take more apples. Then curcumin also I am writing, choline, the Glycyrrhizia glabra. Okay, that also Justimodu also very good for liver fibrosis and a very good medicine. That we also published one case study in an international journal of Ayurveda. And these slide also very important, because these I have a lot of experience on this medicine and case to case vary. But these two is giving to all patients. So 2 and 3 Aragavardhini Bati, Potala Koturanadi Kasayo, Cytogen or Polotrikadi Pachano. You can see and give to many patients, you will get very good cure rate. Okay, it will be reducing the fibrosis also. Next. Next, please. So these are the all, although it is a case study, even bilirubin 37 in alcoholic liver disease, that we are treating that patient, and patient are very nice. and many alcoholic liver disease, even fatty liver disease, liver cirrhosis, liver cancer I am treating, and with a very good result. And CKD also we are treating. Even creatinine 12, 15 like that, it is reduced to 3, 2 like that. So these are Ayurvedic has a very good potential in all chronic diseases. You should have a good training. We have a skill on, you have to diagnose it properly. Then you can assess the patient nicely, and accordingly you can treat. Thank you. Thank you all. No, sorry. All I am very busy on some of the I have some assignment in vehicle. I am conducting this seminar because of the program function of we have Ayush Raksha kit and Ayush Sammanabati that we are distributing in mass scale. That's why I am a little bit busy because I given consent to very early, and Dr. Sarveswara is my very good friend. So that's why I never deny him. So thank you, the organizer. Thank you, the students, for their patient sharing.
Namaste. Surrender to the lotus feet of His Holiness Jagat Guru Shivatri Deshikandra Mahaswamiji, Sikatra Sutur, and also surrender to the lotus feet of Param Pujya Rabishan Gurdev out of living Bangalore, and to the lotus feet of Param Pujya Dharmadhikari Birendra Hegdeji, Dharmasthala. I welcome all of you once again, and respected the program architect designer, HOD Madam, none other than Professor Dr. Bina Madam, Dr. Miti, Madam Manasa, Dr. Sita Devi, Dr. Jyoti, Dr. Subtouch, Information and Broadcasting Minister, Masudanji, and all these PG scholars and our budding doctors of internists. I'll take 2 minutes. Dr. Pandaji, don't leave this program. You be in the program. I know that you are traveling to one, I think, to attend one program. First of all, this program is designed not to know. It's a syllabus point of view. You know that we are preparing for 2030. 2030 is a call for you to be part of integration, which is a new syllabus is coming up, and you can see that Dr. Panda has published. He has the credit of more than 100 publications. So this is why you are bringing these people to you. It is not that in an hour you can get the knowledge is transferred. No, it's not like that. It's just like that, a glimpse of transformations. Just like we are going to temple, that on all and sudden we are not going to get blessings, but we change ourselves, our mindset of we felt something else. So this is the program was designed. It's running for 2.5 months. There are more than 10 legendary, the pan-India, those are really doing the success stories of treating the difficult disease, challenging disease. They are available, they were available with you, and they transport you. Today, in a short time, we could see that Ashok Kumar Pandaji was enlightening you this fatty liver. It's a common, Dushi Bisa, you know, all of you know. The tomato, what we are eating, the potato, what we are eating, that is this common items which is there in the house every day. That is contains Dushi pesticides. That all cause for the fatty livers. But you have a very good medicine in Ayurveda. What Dr. Pandaji was highlighting, the left side of the screen, right to our left side actually, right side of probably to him. For us it is left side, Aravardhani. The name you could read. Composition probably many of you know. It contains Haritaki, Bibitaki. It contains, there are 3 important molecule of prososodis. Shilajot, which is comes Aragavardhani. Vardhani, keep healthy entire body. And so design it is, Shilajit is given, it is for the urogenital systems. It has got gugula, adipose tissues. And if you every molecule if you check, and it is given bhavana with Nimbapatra Swarasya 7 times. Some Vaidyas they give 21 times. That's called Vaidya Bruti. They'll fortify again the medicine giving Nimbapatra Swarasya 21 times. You know, Katugoroini, Picroja Curara, which has liver stimulant. So these drugs are already designed and it is handed to you. How to use, how to get to the globalize yourself, that's the need of the hour. Therefore, this program is designed. What Dr. Bina Madam was the architect designer for this program actually. We are coming out a few programs in audit department. It is a role model for us, Madam. I am already spoken to 2 more departments now. We are coming up immediately. So, what is the today's message is, be available to take the knowledge. Because Zoom platform has given, you know, where is Dr. Ponda now? He's at Bhubaneswar now. He's going for attending 1 more program. He's available in the TV. Every 15 days, 1 TV program is coming for him. So you are the next generation to what we are actually we achieve. You have to achieve more than that. Ayurveda it's flourishing pan India and globally as well. Therefore, my dear budding doctors, get ready, get the knowledge. This is one of the best department in our institution, the Department of Panchakarma. You know, Madam has got 25 patients today. Madam has got 25 IPD patients today, Dr. Bina Madam. And this flow is continuing since it was little bit of in the Omicron and some other second wave. Otherwise, the 25-30% under her, the what you call as the consultancy, it is continuing. This is not a message for you. The success stories are available in our hospital. Therefore, you are a branded, what you call ambassador from this brand institutions. I am proud for that, being part of this organization institutions. Take a great message, like Dr. Ponda, Ashok Kumar Ponda. He has contributed at Gadak College. Dr. Miti Sari is here. Dr. Pondaji, Dr. Miti Sari is available here. Can you tilt this your little the camera if it's possible? Dr. Miti Sari is here. Dr. Pondaji. Jagdish Miti, who was with you at Gadak. And he has contributed to the development of the department at Gadak, the Department of Kai Chikitsa. He has developed the department at Jayendra Saraswati, SGS, Sri Jayendra Saraswati, Dean University at Chennai. He was working there for, I think, for 5 years. 2006, he reported he went back to as a scientist in CCRS, Central Council for Research in Ayurveda. He was holding the charge as Gangtok, as in charge of the department, and now he's at Bhubaneswar. He was there in Calcutta, now he's in Bhubaneswar. Plenty of work they are doing. And it's why I'm telling this much is you also are going to get CCRS job. You are also going to be a part of WHO program. That's the message for you. Therefore, this program is designed. I'm really fortunate to be part of this program. Dr. Miti sir, आपको देख रहे हैं Dr. Panda ji? Yes sir.
Hi, namaste.
Over to Dr. Miti.
Yes.
Namaste sir.
Namaste.
Yes sir.
How? ठीक ठाक है. How are you? Okay now? Hello. Very happy to see
namaste,
you.
Sir.
Very happy to see you.
I am also happy, very happy to see you. After so many days I have met you.
Okay. So.
Dodamani sir become very happy.
Yes. He is in Bangalore. You can invite him. He is a Department of Panchakarma.
Yes, sir. Last week he met me. He came to Mysore, sir, last week.
Yeah, very good. Okay.
Nice to meet you.
Pandaji, please congratulate Dr. Miti. In his department, our institution has historically added PhD studies here.
Very good.
Please congratulate him.
Congratulations.
And also, he is leading the Pharmacovigilance Center in our institution under the IUS. You know about it. And he has felicitated for this year, 2021, is the best Pharmacovigilance Coordinator, for which he has received a certificate.
Yes, good.
For both things, you have to congratulate Dr. Miti, Professor Miti.
Many
PhD added.
Dr. Miti.
Thank you, sir. Thank you very much.
I think I don't want to take much time. You have almost 1.5 and 2 hours. You are watching this program. Also, thanks to our all the 10 that is called resource persons. Those have contributed to our knowledge of our budding doctors. Once again, profuse thanks to the department of Panchakarma, the leading department. I already said it. And also I expect the PG students, you should take the brand of, I have highlighted already to my honorable director regarding the, I think you have done, no? That is Parkinson's. Who has done it? Somebody in the department. They are not here now. Okay. But they have brought out a very good medicines in the department for Parkinson's. The result was excellent under the guidance of maybe Sita Devi or Madam Bina. I don't know exactly that day I was attending. So these are the contribution to the mankind. I will tell you. This is the contribution to the mankind. Parkinson's is not a disease. You know about it, or you have seen the patient also.
Okay.
In the last and not the least, Dr. Pandaji, I invite you to visit this organization. You have visited when the institution was running in the whole building.
Yes, yes.
Now it is. It's
Bani
a globalized. It was in the whole building in Bani Mandap.
Yeah.
Now it is put it up Chamundi Goddess. So your visit is 25th year is going to start now. Your visit shortly probably you come to the 24th, 23rd and 24th. Pharmacology program is there at JSSAMC College. We invite you. And silent to that, you can also have a live guest lecture here. With this, I thanks everybody.
Okay.
And let us feel proud about JSS and the department too. Thank you all.
Thank you, sir. It's time to thank all for the successful conduction of this case discussion series, for which I welcome Dr. Manasa Madam. Madam, please.
Pranamas to the lotus feet of His Holiness Jagadguru Shri Shivaratri Deshikendra Mahaswamiji. It gives me an immense pleasure to propose vote of thanks in the valedictory program of Yukti 21-22, an online case discussion series organized by Department of PG Studies in Panchakarma. First of all, I would like to thank our today's chief guest, Dr. Ashok Kumar Panda sir, Research Officer, Central Ayurveda Research Institution, Bhubaneswar, for sharing his knowledge in the management of non-alcoholic fatty liver disease. Thank you very much, sir, for accepting our invitation in your busy schedule. I wholeheartedly thank all the eminent speakers from Pan India who shared their clinical success stories and enlightened our students with the Yukti behind their success. Thank you, all the speakers of Yukti 21-22 series. I take this opportunity to thank our patron, Dr. C.G. Besturmat sir, Executive Secretary, and co-patron, Shri R. Mahesh sir, Director, Medical Education Division, JSS Mahavidyapita, for their able guidance. My sincere thanks to our beloved principal sir, Dr. Sarveshwarkar, for his constant support and guidance throughout the series. I thank our Dean Academics, Dr. Rajesh A. Udupudi sir, for his encouragement. I thank our Organizing Secretary, Dr. Veena G. Rao, HOD, Department of PG Studies in Panchakarma, for organizing such a unique program. I thank Dr. Sita Devi P. and Dr. Jyoti from the Department of Panchakarma who helped us in all the aspects. Special thanks to Dr. Madhusudan sir and Dr. Aditya for technical support, without which broadcasting this program was not possible. I would like to thank AOs of both college and hospital, all teaching and non-teaching faculties for their support. Last but not the least, I thank our beloved students, both UG and PG scholars, interns, for their active participation in making this program successful. Thank you one and all.
Thank you, madam. Thank you all. Wish to meet you all virtually in the next program. Thank you all. Namaste.
Yes.